Assalamu alaikum and a very good morning to you all. I hope you guys are doing very well today and you're ready to start your day with me, Maha Muqteem, and the wonderful Shazad Khan. Assalamu alaikum, Shazad, how are you?
Walaikum assalam. I'm absolutely perfect going
Good.
through the week. I mean, it's Thursday. I feel great because it's very soon going to be Friday and then, the weekend's there. But then on another
Weekend is
note,
always
ladies
fun.
and gentlemen, whenever we are here, whenever we are on air, for everybody who's tuned in, we try to spread awareness. We try to share pieces of information which are useful for you. And,
Exactly.
in the past days, we have done that too as well. We have been highlighting the pink ribbon campaign, and then we have been highlighting the white ribbon campaign, which was violence against women. I
And
mean,
it's still going on. It's a 16 days activism. It is until the 10th of December as well.
exactly, but today is a very important day because of the fact that it's Red Ribbon Day. Now, quite a lot of people might not even know what Red Ribbon signifies. Now, when we talk about Red Ribbon is obviously, spreading awareness about AIDS and HIV.
Yes.
75, obviously, we do stand in solidarity with those 75 million people who were infected with AIDS or HIV, but out of 75 million, only 35 million live today. So, the only problem what we need to highlight over here is that how can these lifespans be extended, or why the vaccine is still not available, or how is the situation in Pakistan, what is being done, what measurements or precautions are taken, because this year the theme we are taking forward is basically the prevention.
Exactly. And each country has their own. In America, it's about the mobilization, it's about the legislation, it's about the system in place. In England, it's about going forward and less stigma attached, because there's a lot of a stigma attached to this situation. So to discuss what is this, happening within Pakistan, we've been very lucky. We've been joined by Dr. Manzoor Al-Haq. He is part of the United Nations Office on Drugs and Crime, and he is a drug demand reduction and HIV/AIDS advisor. Assalamu alaikum, good morning.
Walaikum assalam.
Thank you so much for joining us
That's
today.
like too
Thank
big
you
of a
very
title
much.
connected to
Yeah,
it.
of course.
No, wonderful. Besides Dr. Mansoor, we've been joined by Mr. Nasser Sarfaraz. He is an HIV/AIDS specialist with UNICEF. Assalamu alaikum, good morning. Thank you so much for joining us. Besides Mr. Nasser Sarfaraz, we have been joined by Fahmida Iqbal Khan. She is working with UNAIDS as a community mobilization and networking advisor. Assalamu alaikum, good morning.
And she's got a great smile on her face. I don't know why, which I think might be a bit, I mean, it gives me a hint that, there's something naughty going on in her head, but I don't know what it is.
Okay, besides Ms. Fahmida, we've been joined by Dr. Naseem Akhtar. She is an infectious disease expert. Assalamu alaikum, good morning. Thank
So
you
I
so much
think
for
to
joining
get
us.
started with conversation, we'll start with Ms. Fahmida over here. Let us know about this year's theme and the campaign, and what are we doing to spread awareness, or probably to let people know about the prevention of this lethal disease.
Thank you very much. This year's theme is HIV prevention, and it got started. It has a history way back when it comes to World AIDS Day commemoration every year. From 1987 August, there was two information public officers, those who were working in World Health Organization. One was James Bunn, and then other was Thomas Nutter. And then they both thought that it would be good to have a public awareness campaign every year. And they started off by focusing on HIV epidemic and prevalence among children and youth. And then later on, when UNAIDS got started in 1996, the entire promotion and then commemoration of this World AIDS Day got the responsibility by the UNAIDS.
Okay, but that's something which anybody can get to read on
Yeah.
Wikipedia anyways. But what are we doing in Pakistan?
Well, when it comes to Pakistan, Pakistan is having a concentrated epidemic. It's not a generalized epidemic. It's not prevailing among the general population. It's right now among the injecting drug users. It's among, transgenders. It's about sex workers, and then migrant workers, and then the prisoners. And these are the vulnerable key population with whom nobody actually, at a larger scale, they don't work. We have, in Pakistan, the government under the Ministry of Health, we have National AIDS Control Program with whom we are working. And the National AIDS Control Program have the provincial chapters as well, and they have the provincial AIDS Control Program in all the 4 provinces. So when it comes to HIV prevention, let me also quote a couple of statistics.
Please do,
Yeah. In Pakistan, the prevalence, estimated prevalence among, population is 0.1%, which says 100,000, around 100,000 people. And those who are registered are around 17,000 or something. But when it comes to these people, those who are injecting drug users, 27.2% HIV prevalence is among the injecting drug users. But it's a general one when it comes to Pakistan. When it comes to specific cities like Faisalabad, it has 52.5% prevalence among the injecting drug users.
Right, okay.
So this is something which we have. And the second largest population among the where the HIV prevalence is very high is transgenders. It's
Okay.
5.6%.
Okay.
And then the sex workers come. But the major message, the key message is that it's not through the sexual transmission in Pakistan. Rather, it's injecting drug users.
Okay.
So this is how it's
So
prevailing.
it's about building on the knowledge that people already
Yes.
have. Okay, now we've already highlighted why it's kind of important, but I will get Dr. Manzoor to specifically say why is it important for us to observe it within Pakistan, within the general population?
Yeah.
I think it is it's very important because, as Fahmida very rightly said, that although the prevalence of HIV among the general population is still very low, it's 0.1%, and we are lucky enough to have this sort of figures in Pakistan. But as far as the prevalence of the national prevalence of HIV among the people, those who inject drugs, is very high.
Okay.
It's 27.2%, as Fahmida very rightly said. And in some of the cities like Karachi, in Sindh, and Larkana, and then coming to Punjab, Lahore, and Faisalabad, a couple of other cities, the prevalence of HIV is very high. It varies between 40 to 50% HIV among the people who inject drugs. So it is not basically, we cannot say that HIV is something which is only associated to a certain group of people.
Right.
Because it spreads into the general community by different modes. And these are the basically people, those who are the carriers of HIV virus, and they can easily spread. And there are different means of spreading, and especially when it comes to injecting, it becomes the most potent and easy way of transmission of HIV.
Okay.
And they are the people, those who are usually involved into selling blood and selling blood, definitely in people, those who are in need of blood and they don't have relatives ready to give their own blood to their own dear ones. So these are the people, those who are there to sell their bloods. And I believe that in not many cases, sometimes the blood is not even screened for HIV, and when it is given
That's how
to
it takes place. And I mean, I don't want to say that, but I think since I've had this experience, so one of my uncles, he went into an accident, he suffered quite a lot, so there was blood transfusion, he got hepatitis. And that's how it happens because, the
Same,
hospital
my
didn't
uncle.
really screen it, they didn't check it. So ladies and gentlemen, first thing, since we're talking about awareness, whenever, you think that there's going to be a blood transfusion which is going to take place, make sure that the blood is tested by the hospital, or you can probably get it checked from any other lab too. But now, sir, moving on to you. First of all, what is the importance of World AIDS Day for you, for our nation in the first place? And then what is the basic difference in between HIV and AIDS as well?
Okay, let me start with the difference between HIV and AIDS.
Yeah.
HIV is the name of a virus. It's called human immunodeficiency virus. When it enters the body, it takes over time to spread in the body and take over the body's immune system, and then a syndrome of diseases develops. Then it is called acquired immune deficiency syndrome. So virus developing into disease,
So
HIV
the
is
first
a
thing which happens is HIV, and then it leads on to AIDS.
onto AIDS. And now coming to your first question, that is more important, that why is important for us to celebrate World AIDS Day in Pakistan. Saying that HIV is confined to key populations or high-risk groups is okay, but it somehow or other gives the impression that this disease is for people who are not really part of the mainstream society. But especially when we are talking about UNICEF, when we are working for children and mothers, it is very important that we create awareness among people that mothers who are HIV infected have a chance, have a possibility, if they are diagnosed in time, then they can stop transmission to their children.
Amazing, okay.
And interestingly, since UNICEF is supporting the government of Pakistan and in provinces in prevention of mother-to-child transmission of HIV, most of the women, more than 90% of the women who are infected from HIV don't have any risk behaviors with themselves. They have been infected by their husbands.
Exactly. Yeah.
Either who are working abroad or who are injecting drugs. So it is very important for us to convey this message to the people of Pakistan that any woman who considers herself to be at risk should get tested, especially if she's pregnant, so that measures can be taken to prevent transmission to her infant, and that is possible.
Excellent. We will talk about the different modes as well in a moment, but I'd like to bring Dr. Naseem into the conversation. Let's delve a little bit into the differences between, as Mr. Nasir just told us, the difference between HIV and AIDS. Now, how does one get to that point where it turns into AIDS, and what are the dangers of this?
Yeah, I would like to highlight more on the differences between
Please do,
HIV
yeah,
and AIDS.
A bit louder, please.
HIV is basically a virus. So it's just like a virus like hepatitis B virus or hep C virus. But HIV virus is a bit different from the other viruses because once it gets entered into the body, it ends up in the disease which is not a self-limiting disease, right? So most of the viral diseases, they are self-limited. The people, they get cured because they are self-limited. But once HIV enters in the body, it gets through your system and it invades your immune cells. Basically, we call them as CD4 cells. They are the protective cells in our body. And this virus invades those cells and continue to destroy those cells. So basically, we are deprived of the natural immunity. This ends up in different diseases. So once the virus is inside the body, it keeps on replicating. And once the patient gets the signs and symptoms related to that virus, it leads to a syndrome. So it's a combination of different signs and symptoms which leads to AIDS. So
But
AIDS
let's-
is basically acquired immune deficiency syndrome.
Okay.
So once a person gets HIV, it does not mean that person is having AIDS.
Yeah.
So it takes some time.
Okay.
In some persons, it may take up to 10 years, and sometimes it may be a rapidly growing virus, and a patient quickly ends up in AIDS.
Okay.
So important thing is that those persons who have acquired the virus, they can silently transmit this virus to the others.
Okay. Before
So
actually
this is
knowing.
very important.
We'll
because-
definitely talk about it, but let's talk about the symptoms because people over here, they do not practice going to the doctor anyways throughout a year. When they fall ill, or they fall sick,
Exactly.
that's when they go to the
Exactly.
hospital, and then, the situation is quite worse. So what are the symptoms? Or probably, when you have HIV, how would you look? Probably you'll cough, probably you'll get flu, it's
Yeah.
going to stay longer. What will happen?
Yeah, this is important. Once the virus gets into the body, initially the patient develops the symptoms which are very much similar to various other viral illnesses. Like patient might have flu, may have enlarged lymph glands in the neck. It may be, simply just like an influenza infection. And most of the people, they don't get to know that they are suffering from HIV. This is called acute retroviral syndrome. And usually it is missed. And after that, the patient enters into a stage where he becomes asymptomatic. And this period of or symptom-free period might be prolonged.
Okay.
So during that time, patient is not knowing that he is having the disease. So after some time, the patient starts having fatigue, weakness. Patient may end up with having chronic diarrhea, and it may be persistent, maybe lasting more than 1 month. Patient may have fungal infections in the mouth. There is extreme weight loss. Patient is unable to eat properly and he becomes wasted. And there are specific infections which are related to AIDS, they may develop.
Okay.
And tuberculosis is also very much common. Patient may end up with TB, they may end up with specific cancers which are related to HIV like lymphomas, and females may have cervical cancers. And as the CD4 counts, they go on declining, patient go on to develop AIDS.
Okay, so it's basically, that sounds really terrible. But now, let me ask Dr. Manzoor, once someone has got HIV, or AIDS, what is the how long do they live for? What's the life expectancy? If it goes untreated, it goes unnoticed.
Actually, there is no fixed time duration for somebody after having HIV. The lifespan could vary
Right.
from 8 to 10 years or to 15 years or even more. But it all depends what is basically the general health of a person. And if he is taking some medicines which helps him decreasing the viral load of like HIV, it keeps on growing, as very rightly Dr. Saba said, that it keeps on growing and it keeps on decreasing your immune system and affecting your immune system. If you start taking medicines on time and it's been diagnosed earlier, so it helps you reduce your viral load in your blood, and that helps you increase your life duration and even your quality of life. Secondly, it also depends upon how you take your nutrition, how you take your food, and how you take care of yourself. So these are certain limitations, because as very rightly said that if you reduce your immune system, even the opportunistic infections like influenza, tuberculosis, many other infections, they can get an entry into your body and they can destroy your body. And the people, they usually do not die because of HIV, but they do die because of the opportunistic infections that destroy their body.
Okay, and so the situation within Pakistan is quite bad then, because I guess the people who are vulnerable to HIV and AIDS, they can't access any of these things.
The environment in which they live, the nutrition or the food they take, the sort of awareness and information they have, access to medicines, right medicines, and then your compatibility and with the medicines. So all these things basically, they add up. And if a person who has all these issues, all these problems in his life, you don't have an access to medicine, you don't have access to proper nutrition and environment and living conditions, definitely the
We will definitely
lifespan
talk
would
about
go
that.
down.
We'll definitely talk about the treatments available. But I just wanted to move on to Miss Fahmida over here. Now, what happens is that, you said that it's the transgenders, then you said that it's the prisoners, all of those people within the community who are ignored to the extent that we just don't want to be in conversation with them as well. How do you think that we are in near future, because we are spreading awareness today over here, how do you think that in near future we'll probably come up with a way or a method where people would get to know that this guy's actually got this disease and, such a relation with this guy or probably this human being can lead to an infection, which will obviously with me then. So are we coming up with such a way? Are we thinking about it? Probably, a card
protect
or something.
themselves.
Yeah, how to protect themselves, because you can never ever be sure of what disease the other guy or the girl might have.
Well, yes, absolutely. With HIV, it's pretty much different. It's
Yeah.
pretty much different because it's highly stigmatized. It's highly discriminated. It's not like, like a regular fever or regular temperature or flu, influenza, or even hepatitis. I mean, people literally socially boycott those people, those who get HIV, and they are diagnosed with that.
Yeah.
What we are doing is Pakistan came up with the Pakistan AIDS strategy from 2016 to 2020.
Great.
And keeping in mind the sustainable development
Yeah.
goals, like in the post-MDG era, because this is something where we are talking about leaving no one behind.
Yes.
When we talk about leaving no one behind, in order to move forward, that means taking everyone along with you. And it can only be possible achieving these targets by 2030 only when we, include everyone. And for this, the one way which we are doing right now is spreading awareness. Unless people are aware, and specifically when it comes to youth, I mean, Pakistan is having a youth bulge of more than 60%, and they are mostly not aware. If you talk about awareness raising, the prevalence of the awareness raising ratio among the women and men, it's pretty much low. It's 4.5% or 5.3%. And with this kind of awareness ratio, I mean, how can you expect that the people can prevent themselves? So one way of this is that spread the awareness, and then also making these tests available at the hospital level so that people can come out freely. Right now in Pakistan, the testing rate is very low. It's 6%. And we are talking about reaching to 1990, the 390s, which I will discuss about that. The 390s is 90% of the key population, which I just mentioned, should be tested. 90% of those who have diagnosed with HIV, those should be on the treatment. And 90% those who are adherent to the treatment, their virus should be suppressed so that they cannot transmit this infection further.
I mean, that's great. But then on another note, what we can probably do is that we can send mobile units, get people checked, that it's a mandatory, and then probably write it somewhere within the forms
Okay,
that,
let me
this is
correct
what it
you.
is.
Let me- yeah.
Yeah, but I know it's not possible.
Yeah.
But now what I wanted to ask from you is that, what are the different treatments which are available over here in Pakistan, and are they like very expensive? Are they not? Because people do not even know about that.
So there are not many kinds of treatment that are available for HIV, and probably Dr. Naseem would be a better person to discuss that.
We will
But
discuss that.
anyway, but the treatment available in Pakistan is free. The best thing is that
Really?
Global Fund is supporting government of Pakistan
Excellent.
for procurement of drugs. So
In every hospital?
There are selected hospitals, not all over. Like there are about 21 hospitals across Pakistan where the treatment for HIV is available, and it's absolutely free. Anybody can go there, get himself or herself checked, and get the treatment for themselves. And so that's the best part. But again, coming back to your question about awareness and HIV, the point that I'm trying to emphasize is that we do talk about risk populations or key risk groups, but as I said earlier, that women who are positive are mostly not from these groups. So every year there are roughly 2,900 to 2,000 women in Pakistan who are HIV positive and pregnant. And their children, if the women are not reached and they don't know that way to get tested, they might continue with the pregnancy without any treatment, and the child has a chance of 45% being born with HIV infection.
Right.
So this platform is ideal to give this message to every woman who is married or who is of reproductive age, that she should get herself tested if she thinks that she is at risk
Okay.
or her husband is at risk.
Okay, I did want to move on to you and ask you about the role of UNICEF within this whole campaign and raising awareness. Now you said that mothers can prevent their child from getting it. So there is no. I mean, even I don't have awareness of this. I didn't realize. I thought that if you had HIV, your child is going to get it. For sure. So tell us a little bit more about that. How can the mothers, especially in these rural areas, prevent their child from getting it? What's provided for them?
First of all, it's all about awareness. And interestingly, I would like to also share that all over the world, mostly, it is called, the strategy for prevention is called PMTCT.
Yeah.
It is called Prevention of Mother to Child Transmission of HIV. But in Pakistan, we tweaked it a little. So in Pakistan, we call it the Prevention of Parent to Child Transmission of HIV. Because most of the mothers are infected from their husband.
Right.
So it is important that the father knows his risk status, or knows his status and doesn't infect his wife. And if wife gets infected, she knows her status and child doesn't get infected.
Okay.
So in all the centers that I mentioned, there are 11 PPTCT centers across Pakistan, where any woman who thinks that she might be infected can get herself tested and continue. So essentially the mother gets treatment.
Okay.
If the mother is treated for HIV, then there is less than 3% of a chance of a child becoming infected.
Okay, so that's
And I would like to share with you that within Pakistan, we gave services to about 411 women over the past couple of years, and none of the child was infected in which the mother was receiving treatment.
Wonderful.
So this is 100% successful in Pakistan.
Excellent.
But it can only be 100% successful if, in case you guys are going to go and get yourself tested. Otherwise, there's no chance. But over here, ladies and gentlemen, we do need to go for a short break. But very quickly, I want to say one thing, and that is that, in the rural areas, probably what happens is that, for example, if somebody's son has got such a viral or probably such an infectious disease, what they do is that they probably hide it from the entire family, they hide it from the external family, and then they probably get their son married too because, they wanted him to get married. So please stop doing that, and if you probably aware of the fact that, there's somebody who's infected with it, please don't ruin somebody else's life. You need to go for a short break. When you come back, we'll talk about different treatments which are available over here with Dr. Aseem, obviously. Good morning.
Welcome back, everyone. And before the break, we were in discussion with our guests about World AIDS Day and what is the situation within Pakistan. And actually, we're not doing too badly. The percentages are quite low, but the thing is is to keep it low and to also prevent it from spreading. So now, going back, we've briefly touched upon the testing of HIV and AIDS. Now, let's go a bit further. What kind of testing is there within Pakistan? We know there's about 20 hospitals that do it. So, Dr. Naseem, if you could tell us a bit more about the process of it.
Yeah, for HIV testing, we have different tests available, but the most important thing to highlight is that we have HIV rapid test. This test is very convenient to do, and once you suspect a person having HIV, you can ask him to go to the laboratory, and it is just a 10 to 20 minutes test, and you can rapidly get a report. And this test is highly sensitive. Like it is about 99.9% sensitive, and you can say with surety that this patient is having HIV or not.
Okay.
Okay, so then, go on.
I'd like to add something.
Please do.
Yeah, so there are two kinds of ways to test HIV. When a virus enters the body, body reacts and it creates antibodies. But for the creation of antibodies, it takes some time, roughly 3 months. So if you want to test an antibody, it will become positive after 3 months. But prior to those 3 months, the virus will still continue in the body and the person will continue to infect others.
Right.
So the test for testing virus is not very commonly available in Pakistan. It's only in 3 major hospitals across the country. So we have to understand one thing, that if a person thinks that he has been exposed or she has been exposed, and if they go for a conventional antibody test, and if they are negative, then it is the duty of the doctor or the counselor who has performed that test to guide them that they have to come back after 3 months again to make sure that they are really negative. And I think coming again, because I'm UNICEF and I've talked about children, any child who is exposed to HIV, by exposure I mean that a mother is infected and the child is born, even if the mother has taken all the precautions, then there's still a chance that the child might be infected. And WHO tells us that it is very important that every infant, if he or she is infected, should start treatment as early as possible to increase the chances of life. But unfortunately in Pakistan, that virus test is only available in Lahore, Karachi and Islamabad. And a child can only be tested on that test. So the children who were born in further districts like DG Khan or Rahim Yar Khan, they couldn't be tested. So now we are working with the government of Pakistan and provincial governments to introduce a system of early infant diagnosis. So inshallah, by January in Pakistan, every child who has been exposed to HIV will have an opportunity to get tested, and the virus will be tested and start early treatment.
Brilliant that is. But we're very quickly moving on to Dr. Naseem over here. Since, I always wanted to ask about the treatment, but so let's just talk about it. What are the different treatments available for HIV first? And then, if somebody enters into a phase where it's known as AIDS, what can we do? How can we, spread the chances of life expectancy?
Luckily, we have certain drugs available for the treatment of HIV.
Tell us
and
about
this is basically called ART, or antiretroviral therapy. So we have few drugs available from 3 groups, which are called nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, and the integrase inhibitors. And we have few drugs available from there, but luckily those drugs are working, and we are prescribing those drugs to those patients who are having HIV positive status and who are eligible for the treatment. So we are providing these drugs in combination. These are called fixed drug combination, FDCs. So there is dosage convenience. So with the introduction of antiretroviral therapy, the patients, they become asymptomatic and their virus becomes suppressed, and we keep on monitoring that whether these patients are now improving or not on treatment.
Okay, wonderful. Dr. Manzoor, let me ask you, because you're working with the UNODC. Now, when you have these people, when they start taking treatment, do they continue it? Do you see any positive improvements? What's happening on that level?
Like, you mean to say treatment on...
Treatment of HIV or AIDS, because you're working with the people on drugs, etc.
Actually, with people, those who inject drugs, you are facing 2 major problems.
Exactly.
One is that they are injecting drugs and they have their lives which are unmanageable. They cannot manage their lives properly. And secondly, if they're suffering from HIV, so that is an additional problem. For a common man, if the person is diagnosed with HIV and and start taking the ARTs, the prevalence of HIV or the viral load in the blood of a normal person who is not a drug user, it can drop because of its compatibility, and secondly, it's making use of these medicines on daily basis. For a drug user, even if you put that person on ARTs, antiretroviral therapies, he may not show that sort of a compliance,
Right.
which a normal person would do. So, to me, I believe that a person who is injecting drugs and he has an additional problem with HIV, we are facing two different problems. So, we need to address these two problems in a different way. So, for that, I believe that we need to have these issues addressed under one roof.
Right.
Putting that person for treatment first, so as because he's also having a medical condition. So put that person into a treatment facility, give detoxification so that the withdrawal symptoms and the other symptoms which restricting that person to make his decisions, proper decisions for his life, he comes into a normal condition, and after that start making him use these ARTs and all that.
Okay.
But you have to be very sure that the compliance with these ARTs is maintained.
Okay.
So for that you need to involve the families so that they can also support that person do not relapse and do not go back to
Okay, but
drug
talking about
use.
these ARTs, you know, all of these drugs which are available for obviously the treatment, do we have any, what do we call it? I mean, you know, when you take a drug, obviously there are these effects on you as well, side effects. Yeah.
Side effects.
Sorry, thank you very much for that as well. Do we have any other side effects of these drugs as well, or we do not, or you know, probably
Side effects of
of
the
the
antiretroviral
drugs?
Yeah, I can highlight on that.
Yeah, sure.
Please.
Once we put the patients on antiretroviral therapy, definitely patients do suffer from side effects. With specific drugs, we have specific side effects. Like if we talk about a drug like Zidovudine, the patients develop anemia. Most of the patients, they are already anemic. They have low hemoglobin. But once you start treatment, they start going to develop anemia. So we keep on monitoring their hemoglobin levels. In addition to that, some of the patients, they may develop abdominal pain. There are some of the drugs which affect the nerves. They can develop peripheral neuropathy. There are certain drugs which can affect your nervous system. They get bad dreams, or you know, they have disturbed sleep, and sometimes they do develop depression and suicidal ideation. So we have to individualize each and every patient that who is going to benefit from that particular drug.
Right.
So we have to keep on monitoring and evaluating the patients frequently.
Okay, one more thing.
Okay.
Yeah.
I have
Well,
after you.
one more thing, and that is that, you know, quite a lot of people, since we were earlier talking about stigma and all of these things as well, so people over here, what they think is that probably sitting with a guy who's got HIV or AIDS probably will lead us to, you know, the same disease as well, or probably eating or sharing.
Yeah.
You know, does that really happen, and what type of
No, but
restrictions
that's
do
a
we
stigma,
need to
which
have?
we're going to discuss at the end. So,
Yeah, all right.
Okay, so we're just going to pause that question because
Sure.
before we move on, I just want to ask you, once they started the treatment, is it still like, so after how long does it become asymptomatic? Is that like contagious?
This is a
Or,
very,
you
very
know,
good question.
and once you've started treatment, you know, are you safe? Because, you know, if you're married to someone with it, you know, all that kind of stuff.
Yeah,
And
this
if
is
you
a-
want to try for
this
children.
is a
all
very
that.
good question. These drugs are very good in suppressing the viral load, and the rates of transmission are very, they become very low with the passage of time. But it takes some time. So we keep on monitoring those patients, and especially we keep on checking their viral loads and CD4 counts every 6 months.
So, can
So
we become less
ideally 3 to
infectious?
6 months.
Exactly. I would like to add to that.
Yes,
Actually,
yes,
till some time back, there was a certain level after which you put a person on treatment. But now that's not the case. But in Pakistan, like, there was a certain level of CD4 count after which a person was eligible for treatment. But we did a study in KP, you know, with the KP government, and UNICEF supported that, wherein husbands who were positive and wives were negative. And husbands were put on treatment irrespective of the CD4 count, just to see that whether this treatment works as a prevention as well.
Okay.
So at the end of 1 year, about 88 people were on treatment, and all of their wives were negative. So that proved that the viral load of the husband was so low that he would not infect his wife.
That's amazing. So
Yeah.
this is really good. Okay, and now before we move on to Shazad's question, I'm really sorry.
It's all right.
Let's talk about the report. I
Okay.
almost forgot about the report. So let's tell us,
Okay,
tell us
well,
quickly about that.
Because whatever has been discussed till now, it's all about different people at different life cycles and approaches. This report, which I just would like to show, it's like get on the fast track approach, and it's about life cycle approach.
just hold it for a while
Yeah.
and, yeah,
So it's about
keep on talking.
okay. So it's about finding solution for everyone,
Yeah.
and that's where if someone is born HIV, how to deal with that person throughout the life cycle. Because right now we have a treatment. Let's not forget we do not have a cure.
Okay.
We do not have any vaccine available, although has been a lot of scientific improvement in that, and there have been a lot of researches going on, but till now we do not have any vaccine available.
Right.
So this report talks about that right now, out of 35 million estimated population, it's 18.2 million those who are on the treatment. But let's not forget another thing. Out of those who know the 35 million, about 50% of the people are there, those who do not know their status.
Gosh.
Oh my God.
So it means what? It means that they went for a testing, they never got this courage to get their results back.
Okay.
So how do you think this report will help us?
This report will help at every stage, from the birth till the old age. It talks about adult, it talks about young people, it talks about all these 4 life cycle
Does it
approaches.
even talk about prevention as well?
It talks about that, and they come up with the comprehensive prevention approaches.
And do we have a prevention vaccine as well, or something of that sort? Because we do have a vaccine
Awareness
for
is a prevention
influenza.
vaccine for us.
Oh, well, yeah, that's really
It's called treatment as prevention.
Okay, so let's talk about now. Let's talk about the stigma. So Shazad's
Yeah,
question.
let's get started. So people think that if we're going to touch somebody, probably sit with them,
Family
eat
wants
with
us,
them, or
sorry.
share a plate or share a spoon, that might infect
Well,
us.
let me tell you, these are all the myths. It's not true. Right now, there are only 4 modes of transmission. Either it's through, injecting, sharing needles. Either it's, blood transfusion, mother to child, or unsterilized equipments. That's the only 4 mode of transmission.
And relations with an infected person.
Yeah, the
as well.
sexual, transmission. That's the only thing. There was one study that was carried out when it comes to, stigma in 2010 and 11. And believe me, the results were literally striking. And they were saying that 52.5% feel stigmatized when it comes to healthcare providers.
Okay, so the
So
people
they
treating
face
them.
stigma by the healthcare providers,
Okay.
because the healthcare providers are not even aware themselves.
Okay.
And they treat these patients with a lot of
Well,
stigma.
actually, no, I'm
Yeah.
going to vouch for. I can't even imagine what someone would go through, because I've gone to the hospitals. The nurses and doctors are pretty judgmental here. They have an opinion on everything.
And,
No,
they,
so-
and they're supposed to take a vow when they get done with their degree, and they take an oath
It's
as well
terrible.
that we'll do it.
okay, now so how can we? Okay, apart
There's
from
another stigma.
No, please tell us the
people,
stigma.
yeah,
Let's
like
get rid of them.
we have seen that people, especially in rural areas, they think that if a husband is infected, they would divorce the wife, and they would somehow that there was a myth a couple of years back that if you marry a virgin, you would be cured. So by the time they, after a couple of marriages, they would infect a couple of wives. So this
right.
needs to be clarified that there is no cure,
Okay.
there's only treatment, and which is antiretroviral drugs.
Right. Okay.
Yeah.
And
That's sad though.
Yeah.
okay, so now the social stigma attached. So people are apprehensive to go and get treated. And let's talk about from the people who are drug users. On top of using drugs, they have got this disease or this infection. How do we now encourage them? Because on every aspect they're facing hurdles. You have the care workers who are judging them, society's judging them. What do we do?
I believe the only solution and the only right way to do things is to create awareness.
Okay.
Engage each and every actor who can play a vital role in prevention of HIV should be part of this campaign.
Okay.
Starting from a household, a family member, till our politicians, the decision makers. Each and every individual needs to be made part. Every individual needs to be educated on that. Because as we know, injecting is the most convenient way of transmitting HIV.
Right.
And it is the major, basically, contributor to spread of HIV, and it contributes to more than 27% of prevalence of HIV among injecting.
Yes.
So that is something that needs to be added upon. And secondly, I would also say that in addition to HIV, drug addiction also needs to be made part of your health policy, which is not yet there.
Okay.
And once it becomes part of your health policy, it will give an equal importance as with other healthcare issues. So once it becomes a health issue, then definitely these people will also get an
Yeah.
appropriate treatment for HIV and all that.
And blood transfusion. I think in Pakistan there's a myth as well around not giving blood to your relatives. There's no volunteerism in Pakistan where there's a general. So anybody, any family who requires the blood, it is much better for a family member to donate blood to that family instead of going out to a private blood bank and buying
Only if
blood.
that family member is well educated and he's well aware
And
that he's
he's
not
also
got any other disease. But you know, what type of campaigns are we planning ahead this year as well for to
Awareness.
spread awareness?
Well, basically, we are working with the religious leaders. We are working with parliamentarians right now. There is a SDG task force for parliamentarians,
exactly.
and there is a secretary at the National Assembly. We are engaging with them. And then in order to reduce the stigma, we have to really create this enabling environment. And that enabling environment can only be there if we have solid legislation. We have one in Sindh with the name of HIV Prevention and Control Act, but unfortunately, the implementation is a big question mark.
Okay, so it's about the implementation.
Yeah, one last thing.
Okay.
What about Punjab, Gilgit
We are
Baltistan?
for Punjab right now they are
KPK.
working on HIV legislation for Islamabad Capital Territory. We are supporting them. KP is really keen, but we have to. Yeah, it's really difficult.
And Balochistan?
Balochistan
Okay,
right now
and
there is a
just
question mark.
quickly,
No, no
just
further
before we run
details.
out of time, I want to ask you, this is just a very general question, because it's not just in Pakistan where there's stigma. This is a universal, this is a global thing where someone mentions AIDS or HIV and everyone's like, oh my gosh, it's a scary thing because there's no cure. Why is it? Is it because of the way it's transmitted? It's got this negative stigma attached to it. Why do we have that? I'll ask Nasser this question.
I think it's just got something to do with the original campaigns that were run in the 90s, that AIDS
Yeah,
is death,
exactly.
AIDS is there's no cure. So I think that social gap still continues, that way AIDS is related to death.
Okay.
And when people just have not really been able to internalize that now there's a treatment available. And so if you introduce somebody in Pakistan that this is a person with HIV, even among my friends, they're startled, okay, so this is the person with HIV and he's normal. So it's still, there's still a social gap which we need to cover.
Okay.
So Famida, are we going to transform the way we have been campaigning or spreading awareness? Because people
Definitely.
are scared
Yeah.
of a person who's got HIV right now, though.
That's why we are working on the multi-pronged approach. One at the community level, where the awareness need to be spread. The another one is at the legislative level. Then we have strategies and the policies, and we have to implement that. One of the key messages that HIV is not over yet. And it has to be, in order to get this eliminated by 2030, we have to really get it through the grassroots level. And it can only be done if we will end the stigma and discrimination against these people.
Wonderful.
And indeed we will, but yeah, one very more...
We're having time for
Yeah,
that.
one very important thing, and that is that, there are people who are not very open of the idea of discussing it with everybody or probably with a doctor too. Do we have any helpline where
Yes,
people
we
can
have.
call
Very
and
good.
talk
Yes.
to a guy and tell them, this is what I'm going through?
Okay, there is an association of people living with HIV, and they have a free helpline, which is
Very nice.
0800 22209. I'll repeat, 0800 22209.
0800 22209, and this helpline is being operated by the people who've got HIV. It's like an association, so I think you can probably relate to them as well. You can ask all of the questions you want, and it'll be of great help
Exactly,
anyways.
and we will share your Facebook page as well so that people can connect to you. Thank you so much for your time, and I
Thank you.
hope next time we talk to you, there'll be positive results.
Inshallah.
Thank
Sure.
you.
Thank you.
So guys, I hope you took something from the show. In Pakistan, we're at about 100,000 people infected that we know of. So let's try and keep it low and not catch up to the rest of the world. So awareness is the key.
Exactly. In fact, we have to get rid of that. That's why these awareness campaigns are taking place. Please make sure, because one of the best marketing tools ever is word of mouth. So please make sure that wherever you say, talk about it, and make sure that you tell them that it's not really a very scary thing to see somebody who's got HIV, and in fact, do not even mention right in front of that person.
Exactly.
And don't forget to write to us on our Facebook fan page, which is with the name of
Well This Morning.
on Twitter,
Well This Morning without a G.
on Daily Motion and YouTube.
Well This Morning.
And this fabulous repeat is going to be at
11:05 p.m. and wherever you are in the world watching on Global, just do the time difference and you will see us.
exactly. So 1, 2, 3. Good
Good morning.
morning. Thank you very much.
Thank you very much.